So we need to now address what some of the potential causes are. These are the issues that can affect the halo. And remember, each one of these has the potential to affect all of the others. One of the most common ones, and there is so much more emerging evidence that this is not just something that it can affect a person's speech or their brain development, but this affects all kinds of different things. It's a tongue tie. And why it's so terribly common, I don't actually know. This is something that's ideally caught when an infant or a newborn is latching. They're having a difficulty getting a suck. Unfortunately, that can lead to malnourishment, breastfeeding difficulties. But like we just showed you, it can also affect brain and upper palate development. So that's number one. Number two is going to be a cranial strain. Before we're the age of 2 years old, our skull is still pretty soft. And even up to the age of around 15 to 25, somewhere in there, our skull is always still expanding and developing. If unfortunately we take a soccer ball to the face, we trip, we land on our chin, or like me, you got born with forceps and it creates a strain in the skull bones themselves, this sets us up for problems much later in life. Even if we don't have instant pain or problems, as a child, we have more functional space. But as things start to fuse, as we become teenagers, as we become adults, these strain patterns are the very things that can start to affect all of those different neurological structures. You also have occlusion. This is about how your teeth are actually coming together. And far more important, in my opinion, that rather than having the $1 million smile where your teeth are all straight, the far more important question is, are your teeth coming together in a way that's healthy for your TMJ, healthy for your neck, but also healthy for your muscles and your nervous system? Because like I showed you, if something is not right with your teeth, or there's an incongruency with the shape of your own bones, your teeth can cause so many different issues. The last one here, whiplash. This is not limited again to car accidents. A whiplash is simply put any injury where your head and your neck snap back and forward like that. The strongest ligaments in your neck, they start to get damaged with an impact of no more than 10 miles an hour. So think of sports collisions. Think of even those minor fender benders. And not just the big injuries, but you can have the accumulation of these little injuries over life. Each one of the injuries weakens the ligaments a little bit. So when you're in your 20s or your 30s or your 40s or your 50s, it may be a relatively simple kind of injury, but that's the thing that actually pushed you over the limit. Because even though you didn't have any pain, that problem had been brewing for months, years, or maybe even decades, to the point where your body, despite its brilliant ability to adapt to stress, essentially says to you, dude, we can't do this anymore. And that's where everything starts to come apart. And one of the challenges then for people is that even though their body was able to adapt and they're dealing with a new kind of injury or something like that that's affecting their nerves, it means that you can't just treat the effect at that point. No, what you have to do is you actually have to go back and you have to address what so many of these underlying causes were, so that each piece of it is able to make an improvement in your overall health and your well-being. So here are just a few examples of the types of treatment that work together. Again, I would love to be able to tell you, when you're dealing with tongue tie, TMJ, whiplash, cranial strain, all of these things, that here's the one magic solution that's going to fix everything. That unfortunately would be a lie. When you're dealing, like I said, with structures of the halo, you have to deal with this piece and this piece and this piece. And that combination and that sequence is oftentimes different in everybody. It requires a tailored approach with a team of individuals rather than this just being the one savior. So when it comes to the tongue tie, first portal of entry oftentimes is going to be a myofunctional therapist. This is a trained professional who works to make sure that you are actually using your tongue the right way. This is appropriate for both children and also adults, because If you have a tongue tie, simply put, again, things are not going to be moving the way that it should be. And oftentimes people think that, oh, okay, just get the tongue tie snipped using a laser. You know, that's good. And that might work if you are an infant. But if you are an adult, or even a teenager from that matter, and your tongue has actually gotten weak over a period of time, if you have the laser done first, without doing the rehabilitation that you need to be able to move your tongue in the first place, you're going to be doing the right thing, but in the wrong order. You need to make sure that your tongue muscle is first strong, then a reduction of the laser. And this is something that a specialist dentist oftentimes is able to coordinate for you. If you're dealing with a cranial strain, this is where a craniosacral therapist are brilliant. Even though the bones, once we become adults, they don't move quite the same way, you can still restore some of the flexibility and, most importantly, the movement of the fluid around the brain. So a craniosacral therapist, brilliant. If you are dealing with an occlusion issue, there are all kinds of different dentists out there. Again, some are focusing purely on the straightness of the teeth. Others are focusing more on the airway, and others, such as a neuromuscular dentist, they're doing a series of tests to make sure that when your teeth are coming together, they're coming together in a way that puts the least amount of stress on your muscles and also on your nerves. The last one here, if you're dealing with a whiplash injury, this is what's known as an Atlas chiropractor. That's my profession, one piece of this puzzle. Rather than doing like a gross manipulation, twisting, cracking, or anything like that, what you do is you do a series of diagnostic scans first to see, well, what joints have actually misaligned and then what's going to be a unique treatment for you. When you know that, you don't have to use a large amount of force. It's usually a light little tap and joints simply are able to release. And if you can release the tension through here, again, that releases the tension on the TMJ. So oftentimes people who are going to be seeing a dentist, you want to make sure that the neck is moving the right way. Otherwise, that's the difference between, wow, every single time that I'm going to the dentist, I'm having all kinds of different issues. You're going against the current. If you've got the upper neck in proper alignment, motion, and stability, the dental work is able to work a lot better the way that it is supposed to be. But in the same breath, I will also add that the people who I see in my own practice, you know, they're doing good, but their adjustments are not quite stabilizing. The reason is because odds are they've got one of these three issues that needs to be addressed here. So I repeat, I am not a savior. I do not have all of the magic solutions. This is a complex where all of these things affect each of the others. And are you allowed to have more than one of these going on at any given moment? Unfortunately, the short answer is yes. And I'd like to say that you just snap of the fingers and it's all gone by next Tuesday. This is usually a long-term project, but one where no matter what you do, you've got to be noticing functional improvements within 6 to 12 weeks. You go less than that, honestly, you haven't given it a fair go. But you could also be doing the right thing in the wrong order. So it behooves whoever you are working with to make sure that they are aware of all of these other elements so that you are getting the outcome that you are actually looking for. So what I have here for you are going to be 3 brief case studies where people have a combination of these different things going on. And then I'm also going to show you at the very end a few at-home assessments, things that you can be doing on your own to figure out where is your best portal of entry out of these different possibilities. So what we have here would have been a young woman essentially experiencing what's known as POTS, positional orthostatic tachycardia syndrome. It feels like her heart is just perpetually racing. She feels like her back of her head is completely on fire. If she moves her head in different ways, her neck goes click, and then suddenly she feels super duper dizzy and nauseated, all kinds of different issues like that. What I've got here for you then, these are what are called cone beam x-rays or cone beam CT scans. Not the same as a standard CT, where you can essentially see everything that's going on in her neck, but you can also see what's going on with her TMJ. So you can see that she does have this leaning to the left of her head like this. And she does also have a TMJ disorder. We were able to see that. But what I wanted to illustrate here for you with these pink little lines, remember I showed you that image a little bit before where you're looking at the alignment of the top bone in the neck relative to the base of the skull. So what we have over here would be what's considered very, very normal. The two joints are lined up across from each other. But I also want to draw your attention to this little white thing right here. This is what's called a styloid process. It's an extension of bone that comes off of the base of the skull, and it's the attachment site for a variety of tendons that are going to connect with the jaw and the back of the tongue. And what you should have is you should have a nice big open space between the front of that C1 vertebra and the back of that styloid process. And also point out that's where her jaw would be located. So again, you can see that these things are pretty dang close to each other. But what I want you to see over here on the other side, number one, compare it. You can see space in this joint. You can't see any space in this jaw joint over here. Here you have her C1, and the front of the C1, that guy's actually misaligned relative to the upper part of her neck. But have a look. There's that styloid process on the other side, but look at that. By comparison, there ain't no space. And in the front of the C1 vertebra, you've got a variety of muscles, blood vessels, most importantly, but also nerves. You're going to have the carotid artery, which is giving blood up to your brain. You've got the internal jugular vein, which is draining blood down. But then you've also got the glossopharyngeal, the vagus, and the drawing a blank there, the spinal accessory nerve. But you've also got that ascending sympathetic ganglion. If there is less functional space, even if these vessels and these nerves are not getting overtly smushed, there is less space. So if moving the head in certain directions, it can start to irritate that lining, and it sets up a neurological panic cascade where then a person will feel dizzy, they're going to feel faint, they're going to feel like they're going to pass out, they're going to feel nauseated, all kinds of different things like that. So in her particular case, what she has going on are two things. Number one, she's got this upper neck misalignment. Number two, she's got her jaw, which is getting pushed too far back. That combination of things decreases the space and is setting her up for so many of the issues. Once we found that, guess what? She's doing a heck of a lot better. So that's number one. Number two, this was the first time that I ever stepped out of my lane. This was a young girl who had come to see me because she was having severe, and I mean extremely severe vertigo, whether she was standing or lying down, unrelenting nausea. It was really, really bad. The catalyst in her particular case is that she had just started to see a dentist. She'd had braces put on her teeth, and when I did an assessment for her, unfortunately, I found that her jaw was getting shoved really, really far back. You might be able to see if you're looking on these images right here. Remember I showed you that there should be a huge amount of functional space in the jaw, but her jaw is actually sitting right in the middle. It shouldn't be there. You can also maybe see, it's pretty tiny. You see this little black dot located right there and then right there? That's the cartilage. So that little meniscus that I showed you on the previous slide. Remember that I said that that little meniscus is actually supposed to be sitting at the front of the joint right here? Well, on the left, it's getting compressed straight up. On the right, it's actually shifted and it's getting compressed straight in the back. What this young girl also had was she had what's called a basilar kyphosis. This is a variation of her own anatomy, where simply put, where the brain is exiting the skull, it has to take a sharper turn, which means her margin of error is much smaller than the average person, meaning that when her jaw was getting shoved back, it was essentially kinking her head like this, and it was compressing those blood vessels. When I had a look at her, I said, I'm not sure I'm the right person to help you out here. Number one, and this is why I stepped a bit out of my lane, I think you need to get those braces off immediately. And I referred her to a neuromuscular dentist who specialized in these things. Within a matter of weeks, because they had to travel in order to go see this doc, she was doing remarkably better. She had her whole life back. So the solution, again, is not always just adjust the neck. It's going to fix everything. Nope. Sometimes it's got to be, you need to get the dentist involved. That's what's going to make the change here. Last case I've got for you. This one here is a young woman who, she was doing okay under care, long-term migraines, and she was doing better, but her alignments just weren't stabilizing. And when we had a look at her, he said, okay, put your tongue on the roof of the mouth, and saw that she had a very, very pronounced tongue tie. So I said, I think that we need to address that. So I referred her to a myofunctional therapist. Now, I'll also point out right here, because this is a really, really good example of what I've been talking about with jaw position, is if you're looking at the placement of the jaw right here, so this is the lower part of the jaw, this is the upper part of the jaw. Yeah, you can see that little space right there. But what I'm saying is it should be much, much, much more than that. Her jaw should actually be sitting here. That's on the one side. And this little guy here should be sitting all the way over here on the other side. You can also see that the curve in her neck is completely backwards. So she definitely had the whiplash injury. So we knew that we had a piece of the puzzle. But in her particular case, what I believed was going on is because her tongue tie was so pronounced, she wasn't able to open her mouth the right way, and the consequence is that jaw had shifted back. So what did she do? She went to a myofunctional therapist who started to have her do a series of tongue exercises. After her tongue was stronger, she had the laser procedure done and said, yeah, that was really sore for a while, but then kept doing the exercises so that it was going to heal the right way. And guess what happened? Her neck started to stabilize, and yeah, still gets, intermittent headaches. Not surprised by that because the neck has been injured in the past, but overall doing considerably better. So again, these three cases, I just point them out to illustrate for you that each one of these elements in the halo affects all of the others. Now, the last piece that I have here for you, this is the question, well, how do you know what the best portal of entry is? Should I go see the Atlas chiropractor? Should I go see my dentist? Should I go see the craniocervical therapist? Should I go see the myofunctional therapist? Who do I need to go to see? Now, you can have more than one of these things going on, but here are a few basic hints for you. If you suspect that you may have a tongue tie, fortunately, this one's easy. Just look. Look to see, is there a snip of tissue that is preventing your ability to put your tongue on the upper part of your palate? Sometimes very pronounced. Other times, much more subtle. The question is if you close your mouth, are you able to swallow by putting the upper part of your tongue against the upper part of your palate? If you can, this may not be the issue, but if you cannot, that's a sign that you're dealing with the tongue tie. That's a major factor in here. If you're dealing with a cranial strain, oftentimes the hint is that your face is going to be crooked. This picture of me, it doesn't fully illustrate it. But again, my jaw swings slightly off to the right side like this, and my skull kind of drops a little bit like that. When that happens, that oftentimes will cause your eyes to be ever so slightly unlevel. So the hint, whether you're wearing prescription glasses or even sunglasses, if you put those guys on your ears, but you always find that they're a little bit unlevel, that's a sign that there is a cranial strain distortion, in which case craniocervical therapy may very well help restore some of that balance. Now, when it comes to jaw movements, this is, how you tell the difference between, is this a dental primary issue or is this a upper neck or a chiropractic primary issue? It has to do with how you open your mouth. Now, there's a lot more advanced mechanics that are involved, but this is the simple one here. If there is a problem with your teeth, when you open your mouth, it is going to go straight sideways, what's called a deflection, like this. I'm going to over-exaggerate it. Straight sideways. Versus if you have a neuromuscular issue stemming from the neck, it is going to deviate. When you open or close, it's going to go zigzag. So it will start and end in midline, but it's going to move a little bit abnormally like this. Can you have both a deflection and a deviation at the same time? Yes. What that means, again, is it means that there's not going to be the one-size-fits-all solution. You need a little bit of column A, you need a little bit of column B. So jaw going straight to the side, dentist. Jaw going zigzag, upper cervical chiropractor. Again, there's a lot more that's involved with that, but these are hopefully some basic assessments you can do on your own to see if you're dealing with some kind of TMJ-related disorder, where is the best place for you to start. So there we go. Both an introduction, but also a little bit of a deep dive into some of the TMJ mechanics. Again, jaw disorders are not just a matter of inconvenience, clicking, grinding, popping. They affect your airway. They affect blood flow to and from the head, and they can go on to affect every single dynamic of your life. And even though we oftentimes think, well, the issue, I just need to get treatment for my TMJ. Yeah, that's one piece of it. But we've also got to look at the teeth. We've got to look at the tongue. We've got to look at the skull itself. And we also have a look at the neck, because each one of these elements plays a key role in the overall function of this halo area right through here. I hope you guys did enjoy this video. A little bit longer than I intended, but if you've stuck through the end, I very much appreciate it. So again, if you haven't already clicked that like or subscribe button, please do, because it's going to help other people find this kind of information when they're looking for some of the answers here. If you've also got the friend or the family member you're thinking, wow, I need to see this, please share this with them. And if you want some more information or a deeper dive in terms of what can be done, go over to our clinic website, which is clearchirospokane.com, and also check out some of the other videos that we have on this channel. We'd be happy to help any way that we can. Thanks again for watching. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well.